Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show. Hey everybody, I'm Dr. Nick Circolone. I'm so excited to be here as always. Today we're going to be talking about dry needling. What dry needling is where we find trigger points in the muscle and we insert a small needle. It's an acupuncture needle. Insert that into the area. Now guys, this is not acupuncture, this is dry needling. So there's a difference. And I'll be talking about that in the interview that Julie did with me in a little bit. But if you want to know more about trigger points, watch our show that we had last week, subscribe to our channel, and without further ado, let's watch the video.
Hey, the human body is an amazing thing, and what we're learning about ways to treat it, especially if you're dealing with pain, seems to be changing in new and better ways. So happy this morning to welcome Dr. Nick Circolone. Good to have you.
It's always good being here. I feel like I've missed you over the holidays.
You have. Happy New Year.
Well, Happy New Year.
By the way, Nick is one of those, when you go to see him, you're going to fall in love with him, not just because he'll make you feel better, but because he's so darn nice and interested in you. So you always have fun coming here.
I do. I really do.
Okay, you're talking about something today called dry needling, and that sounds kind of intimidating.
And it's not. You know, people wonder what dry needling is. It's basically a quick history of it is dry needling came about. They found that when they injected trigger points, they got better. They released. The trigger points started going away. What they found was that if they used a solution in there, whether it be a medication or even saline, it worked well. And even with just a needle, it worked well. Okay. So what happened was instead of starting to use hypodermic needles, which are a little bit more invasive when you inject it into the skin, they started using an acupuncture needle, which was very small, thin filament.
But it's not the same thing as acupuncture.
No, acupuncture is a whole different realm and a whole different discipline, which takes a long time to learn. This is just trigger point therapy injections, basically without medication.
Okay, so who is it most suited for?
People that have myofascial pain, they have a lot of trigger points that cause the pain. And I've been on your show before when we talked about trigger points. Trigger points can lead to a lot of problems: shoulder pain, neck pain, arm pain,
Carpal
leg
tunnel?
pain. Oh yeah. And you know, people that have like epicondylitis or lateral epicondylitis of or tennis elbow of the and the elbow, then you have some knee pain, you have some hip pain. I have a lot of patients that come in with some extremity issues that will do dry needling on, and they do really, really well with it.
Okay, so you know so much medically. I know so little medically. So let me ask you some questions, and you can say yes or no. You mentioned the extremity pain. If you're diabetic, good or bad?
Totally different. Now, with a diabetic, their pain is coming from something that's totally different. Dry needling probably won't help some of that.
Okay.
Maybe acupuncture will, but dry needling I probably wouldn't do on that patient. Not that it wouldn't work, but I personally wouldn't do it.
Arthritis?
Depends if it's causing trigger points. If there's arthritic pain, there's a joint issue there. This is more for muscular issues.
Okay. So now you've got me. So Chattanooga's a runner's town. You're out getting ready for a marathon, and you pull something in your knee, and you work it through, but it doesn't go away.
Exactly. Acupuncture or, as I said, dry needling will work well for that, because if there's trigger points involved, we can break up the trigger points using the small needles.
So you're showing us kind of here how it looks. It doesn't look that frightening, and you don't go in very far to the skin, do you?
You go down until you get a little muscle twitch, and that's as far as you go. And what we do is we turn those needles slightly. We don't keep spinning them. It's a very slight turn, and what we're trying to do is microscopically, we're trying to get those fibers to move just a little bit and for that lactic acid to start to dissipate.
So is it something that's going to work best if you do it repetitively?
Yes. You know, acupuncture and, you know, dry needling, anything that you're using a needle on, therapies of physical therapy, chiropractic, it takes a little bit of time. But usually people get results right away, you know, within the first 2 visits.
But your belief still is that the body is so able to heal itself.
Absolutely. Absolutely. You know, in the orthopedic realm, you know, we're looking at joints, muscles, and how can we fix this either surgically or with medication? Where I look at it is, hey, let's look at the body as a whole and see if we can fix this without medication and non-invasive kind of techniques. Now, I will say this. Dry needling is not non-invasive. It is invasive. We're injecting a needle into the skin, so that is definitely invasive. But it's more of a natural approach than other medications and surgeries. Guys, I hope you enjoyed that show. It was a lot of fun hanging out with Julie, as always. She asked great questions. Hopefully that helped you out. And you learned that dry needling can be a great modality for pain management, to get rid of that pain that you may have had for a long, long time. So if you've not tried dry needling, I urge you to find somebody in your area that does dry needling and try it. I guarantee you'll see some results. So next week, guys, don't forget, tune in, subscribe, because we're going to be talking about sports injuries in teens. We love you. Have a great week, and God bless.